Good evening, everybody. We welcome you all to the third GIBS International IC BPS Patient Day. We are currently having three offline centers running with us. One in Apollo Delhi Hospital, one in Delhi at Urogynecology Clinic, and one at Chennai Urogynecology Clinic. We welcome you all to this session on compassion and care for bladder fair. This initiative is taken by Swati Spentos Private Limited. I would like to now invite our chairman GIBS, Dr. Rajesh Taneja. He is senior consultant and advisory urology and robotic surgeon in Indraprastha Apollo Hospital, New Delhi. We have our Dr. Sanjay Pandey. He is GIBS secretary. He is head of department urology, gender reassignment and renal transplantation at Kokilaben Dhirubhai Ambani Hospital at Bombay, India. I request Dr. Taneja to take the lead, please. Thank you.
Thank you very much, Cheshta. I hope you can hear us. Yes.
Very well, sir.
Thank you very much, Cheshta and Deepti. They are the two administrative secretary of Global Interstitial Cystitis Bladder Pain Society, for whom we all work. So, Cheshta, with a very brief ceremony, we'll release the book, then we start the patient audio. I would request Dr. P. Shiv Kumar, our managing director, to release the book of Hindi version. Yeah.
All of you, I request all of you to come up. Dr.
Thank you, Cheshta. You can go ahead and start the patient's video.
Okay, sir.
Hello, I'm Pinky Paul from India. Today I am here to make women aware of BPS. Most of the patients are unaware that they are victim of this disease. They think that it is normal until they realize pain or awkward situation like urgency of passing urine when they are outside. At the age of 27 in 2007, I became a mother, and after that I fell a victim of UTI. Recurrent UTI totally made me upset. I was given antibiotics several times. I was maltreated by so many doctors. In 2019, I came to know that it was BPS, which is called bladder pain syndrome. Most bothersome symptom is urgency of passing urine. Once I went to a tailor's home to give measurement of my dress. After reaching there, I felt an urgency of passing urine, but they were unwilling to use their toilet. I entered into their toilet forcefully and told them sorry for my behavior. That moment was embarrassing, insulting, and helpless for me. Even if I went to market for an hour, I had to search a toilet there. I like to travel very much, but I was scared of BPS. My family was also deprived of traveling because they would not travel without me. Itching, burning sensation in the private parts were very much common in those days. My private life was totally disturbed. I felt pain during physical relationship. That pleasure was turned into pain. A sense of inferiority complex always haunted me. My husband supported me a lot to overcome my problem. Without his support, I will be completely destroyed. He did not leave my hands in those critical days. My husband is such a helpful person. To show gratitude to him will be insulting him. As a Bengali, I used to take Hilsha pomfret very often. I took 3 to 4 times she fishes in a week. I could not eat rice and dal without lemon and raw onions. Pickle is my favorite till now. Unknowingly, I was enhancing my disease. I have been following IC diet since my doctor suggested me for the first time. A BPS patient must leave food like citrus fruits, tomatoes, sea fishes, tea, coffee, spicy food, baking soda, monosodium glutamate, and so on. Potato, sweet potato, pumpkin, broccoli, sweet apple, banana, sauerkraut are good for this kind of patients. To control this disease, you have to follow IC diet, take plenty of water, pass urine at proper time, do Kegel exercise and other prescribed yoga regularly, avoid overstretching and heavy weight lifting. Sometimes urine comes out spontaneously during sneezing, coughing, or lifting heavy weight, but we do not know that they are symptoms of BPS. A woman must change her underwear 3 to 4 times a day. Do not use tight and old underwear. Do not use medicated soap in your private parts. Doctor prescribed me probiotics to give me a balanced gut health. Some medicines. I have completed 6 intravesical installation. Now I am using only probiotics. After a long time treatment, now I am better than before. This disease will not be cured entirely, but it can be controlled 90% if a lady follow IC diet, medicines thoroughly, and exercise properly. It is a long-term treatment, so patient must not be impatient. Now my lost self-confidence is returning gradually. My doctor supports me a lot to overcome it. I am grateful to her to show me the right path and give me an opportunity to express and share my experience with you. Once I told that if there was rebirth, I did not want to be a woman because of this BPS. But at this moment, I am feeling that BPS will be a blessing to me if I can make ever a single woman about this disease in the world. A woman's health is her capital, so don't allow BPS to decapitalize your capital. Be conscious and fight against it and upgrade the standard of women health. Thank you.
मेरा नाम पुनीता सोनी है। मेरी उम्र 38 है। 2 साल पहले मुझे आईसी प्रॉब्लम शुरू हुई थी। सबसे पहले मुझे यूरिन इन्फेक्शन हुआ था। इलाज लेने के बाद भी बार बार होता था। यूरिन इन्फेक्शन ठीक होने के बाद भी मुझे कभी 15 मिनट तो कभी आधे घंटे में यूरिन जाना पड़ता था। यूरिन में जलन भी होती थी, खुजली भी होती थी। बहुत सारे डॉक्टर के पास इलाज लिया, फिर भी बीमारी का पता नहीं चल रहा था। फिर एक गायनोलॉजिस्ट ने बड़ौदा के एक यूरोलॉजी डॉक्टर को सजेस्ट किया। उधर डॉक्टर ने सिस्टोस्कोपी किया और आगे अपना इलाज किया। 5 महीने से मैं उनका इलाज ले रही हूँ। मुझे अब बहुत ठीक लग रहा है। अब मैं घंटे 1.5 घंटे से यूरिन पास करती हूँ और जलन भी कभी कभार होती है। यूरिन की जगह पर रोकने पर बहुत दर्द होता था, वो भी बहुत कम हो गया है।
Now we have Dr. Amita Jain. She is GIBS core committee member, FEPA founder, senior consultant urogynecologist from Medanta Hospital, Medicity, Gurgaon. She'll be speaking on bladder fair. Ma'am, please.
So thank you, GIBS team, for making me a part of this initiative, because I feel privileged to cater patients of IC. And today at my place, I am having a lot of patients who actually don't know that they are suffering with the disease. Once we actually did this awareness campaign, and we sent messages and all the things, they correlated that yes, they are having the same symptoms, and they came to us. So I am talking about bladder flares. Bladder flares, that's mean that you are completely all right, suddenly you are having a a problem of urgency, frequency, not able to hold, and especially if you are a diagnosed patient of IC. आपको पहले से बीमारी था, सब ठीक चल रहा था, अचानक एक दिन आपको दिक्कत शुरू हो गया, तो आपको क्या करना है? So basically, you have to understand that if you are having flares while you are in therapy even, then sometimes what happens that it actually shows that it's still your ulcers, your inflammation in the bladder wall are not healed. अभी भी आपके ब्लैडर में दिक्कत है, और उसके बाद में अगर आपने कुछ ऐसा ले लिया अपने फूड आइटम्स में जो एसिडिक है, on taking acidic diet, that will make your urine more acidic, and that will irritate the underlying nerves, because the overlying the protective layer of the bladder mucosa is damaged, which is pathognomic of this disease. इस बीमारी में यही होता है. So there are things which can be done for prevention as well as for kind of treatment. For prevention, you have to see, you have to mark out that what is causing these kinds of flares. It has been seen that flares could be different types. It could be like it is coming in months, or it is coming daily, or it is coming hourly basis. So it all depends that what is your diet pattern. Suppose if you're taking something in night, then probably it is the morning, next morning you will get the flares. But if you are getting flares at afternoon or evening, it will be a diet which has been taken in either breakfast or in lunch. So that you have to understand. And what are the acidic diet which can cause these kinds of symptoms? To mention few things, spicy food, like taking red chili, green chili, black pepper, any kind of citrus fruits like lemon or oranges, even apple, pineapple are acidic. Taking any sour things like old curd or sometimes milk products can produce problem, but you have to actually see which are the things which are causing problem. Caffeine in any form. So it is considered that green tea is very good. Now people are thinking that for the health they should switch over to green tea, but it has been seen that even green tea is having a high content of caffeine. It's the mint tea or something which is better for if you want to switch over. Similarly, any chocolate drinks, especially dark chocolates or ice creams with chocolates, all these things are containing caffeine and other elements which can aggravate the problem. So avoid these things and what you can do, that you just make your own food diary, and see repeatedly which food items are causing problems, and then you have to avoid that thing. On having this acute episode, you can simply avoid those items, and then you can take some kind of urine alkalizer. These are freely available urine alkalizer, and we promote sodium based alkalizer rather than potassium based, because sodium is better for the bladder mucosa. And otherwise nothing is there, please go to your kitchen. There would be baking soda available in every kitchen. You can take a pinch of baking soda and you can mix it 1/4 glass of water, and you can take it. This will actually solve the problem. Other things would be like, if it is an acute pain, you can get some kind of distracting things that you can use, even hot or cold fermentation for these things. And a few kinds of pelvic relaxation techniques will help you, that you have to sit on a kind of seat where the pelvic floor is completely relaxed. And that's why it is said that avoid long journeys on the bumpy road, जहाँ बहुत झटके लगे, वो avoid करिए, because it can increase the flare. And also avoid, sometimes few patients tell that it is happening after sexual activity. Then you have to be very careful the things you can see that if it is a kind of position where the problems are occurring, so you can avoid those things. And rather, I would like that if somebody wants to ask question about those things, that I will be very happy to answer the things, because for patient, I don't want to go very deep for these kinds of things. It's always better if you are not able to manage flare in say 1 or 2 days time of your own by these techniques. Sometimes patients start doing a kind of over-the-counter medication. They start taking amitriptyline or painkillers by themselves. But I will encourage that if you're not getting relieved, it's better to get your routine macroscopy and culture sensitivity done, because it could be infection, because it's not always that these symptoms are because of the IC problem. Or it's better to consult a specialist or go back to your treating doctor to understand whether it is a kind of flare or it's a disease which is not completely healed. I hope that I gave you a kind of gist of the things, and I'm happy to answer the questions if any patient wants to ask.
Ma'am, we'll take the questions at the end. I'll start playing the other videos.
Yes.
Hello, my friends. I am Rajesh Sivakumaran. I would like to share my personal experiences about IC and IBS. When I was 14 years old, I used to get UTI symptoms very frequently, but after antibiotics, it used to go away. I started having frequency, urgency, burning sensation in the urethra, and burning after urination in the year 2014. Whichever doctor I went to, they only prescribed antibiotics, but my symptoms didn't get better. Nobody could understand what I was going through. It was like a torture. It affected me psychologically as well. I had to pass urine very frequently, 15 to 30 minutes once. My family didn't understand what I was going through, but they sympathized with me. I had to go through the burning sensation myself. It was 24 hours all the time. Slowly after my menopause, it started to get worse. As my estrogen level dropped, the bladder wall would start thinning and urethra would become dry, which also causes these frequent burning frequency, urge and bladder pain. My subtype was bladder wall driven estrogen atrophy, pelvic floor dysfunction along with IBS. So I was suffering with interstitial cystitis and irritable bowel syndrome. Usually these two conditions go hand in hand for some people, and I was suffering with both. With IBS, I was suffering with constipation. Along with this, I was suffering pelvic floor muscle tension, where pelvic floor exercises is a must, along with specific diet. The usual foods which trigger both the bladder and the stomach are tomatoes, lime, oranges, all citric fruits, dairy products, curd, sour items, tamarind, strong masalas and spices. I took treatment for 8 months along with 5 bladder installations. From my personal experience, what I would like to tell my friends who might be suffering like me is the key factor is you have to follow diet prescribed, and the diet differs with different individuals. Secondly, take care of the pelvic floor muscles by doing pelvic floor exercises, medicines prescribed, avoid stress through yoga, and the most important thing is believe in yourself, believe that you can fight it with self-confidence. Thank you.
मेरा नाम सपना नेदे है। मेरी उम्र 40 साल है। मुझे करीब 2019 में तकलीफ शुरू हुई थी यूरिन इन्फेक्शन से। उसमें ऐसा होता था कि जलन होती थी, पेट दुखता था। बाद में धीरे धीरे मैंने गायनेक को दिखाया, उन्हें मेडिसिन दिया, सोनोग्राफी किया, कुछ निकला नहीं। वैसे करते करते 5-6 महीने निकल गए। बाद में ऐसा हुआ कि पेट दुखने लगता था। कभी कभी मैं ज़्यादा बाथरूम चली जाती थी, कभी कभी दिन में 2 ही बार जाती थी, कभी कभी 1-1 घंटे में लगती थी मेरे को। यानी मैं कंट्रोल भी नहीं कर पाती थी, जाते जाते ही निकल जाती थी मेरी यूरिन। तो फिर मेरे को एक गायनेक ने सजेस्ट किया कि आप एक बार यूरोलॉजिस्ट को दिखा के देखो, कुछ होगा तो बता देंगे आपको। फिर उसके बाद मैंने वडोदरा में एक डॉक्टर है यूरोलॉजिस्ट, उनको दिखाया। उन्होंने मेरा ट्रीटमेंट किया। उसके बाद आज मेरे को बहुत आराम हो गया है। आराम यानी समझ लो कि इतना अच्छा हो गया है कि अभी प्रॉब्लम फ़िलहाल तो नहीं है। कभी कुछ रहता है तो ये, बाकी अभी तो कुछ प्रॉब्लम नहीं है मेरे को। तो मैं सबको यही बोलूँगी कि कुछ प्रॉब्लम होती है तो डरना नहीं है, डॉक्टर को दिखाना है। तो डॉक्टर आपको उसका इलाज देंगे, प्रॉपर इलाज करेंगे तो आप अच्छे होगे। मेरे को कभी ऐसा लगता था कि मैं अच्छी होऊंगी कि नहीं होऊंगी, क्योंकि 5-6 महीना तो मेरा वैसे ही निकल गया था। तो पेट दुखना, यूरिन निकलना, और कभी कभी इतना तेज जलन होती थी बाथरूम की जगह पे। तो मैं एक ही बोलूँगी कि आपको अगर तकलीफ़ होती है तो आप डॉक्टर के पास जाओ, तो वो आपको इलाज देंगे और आपको अच्छा हो जाएगा।
Now I would like to invite Dr. Meera Ragavan. She is Senior Consultant Urogynecologist and Robotic Surgeon at Apollo Hospital, Chennai. She is also the core committee member of GIBS. Ma'am, please.
Hello, everyone. Hello, Dr. Taneja, Dr. Amita, Dr. Amita Jain, GIBS core committee members, dear colleagues, friends, and dear patients. It's really a great privilege and honor to be part of this Patients Day Forum, without which we will not learn more about the disease, to be honest. Over the few years we have been associated, we have grown stronger in the depth of our learning about not only the disease itself from a clinician perspective, but actually what the patient wants from us as well. So we have grown in greater strides in learning more about this perspective, and we've come a long way in manipulating the treatments according to the patient's symptomatology. And that is why we are all here. And it was great learning from the patients about how their confidence levels have improved, how their quality of life has improved. Now, to make it even better, we would like to talk about the intravesical installations. I'm not having a PowerPoint for this because most of it has already been elaborated by our patients themselves. Now, these intravesical installation, I give this very simple analogy for the bladder pain syndrome, where you tend to lose the protective layer inside the bladder. Now, this is like a gel coating which is inside the bladder, because all our women and men are very easy to understand. Simple analogy, I give them the analogy of non-stick cookware. Now, the bladder has this lining which is like Teflon, which coats the inside of the bladder, and that is what is lost in the process of the disease. So when the non-stick layer is lost, or the Teflon layer is lost, like when the cooking, it causes burning and particles stick to the bottom of the pan. Similarly, when the bladder protective layer is lost, any food particles, especially acidic in nature, sour in nature, irritate the bladder lining and the nerves. And that is what causes excruciating burning pain, inability to sit in a place, pain which is in and around the area, and muscle spasm which comes along with it, and frequent urination. What we are doing by this intravesical installation is preparing a mixture of various medicine which help regenerate the layer as well as protect the nerve endings from such irritating particles. So we are recreating that non-stick gel-like layer by applying these mixture of medications inside the bladder, which can be done every fortnight, every month, according to how the improvement in the patient's symptomatology is. We have now started using pentosan itself as a dissolved material and instilling intravesically, which I have started doing in a couple of patients. And to my surprise as well, these patients have done extremely well within a couple of installations. That is very encouraging from a clinician point of view, as this is one of the available options and the door is not shut for these patients who have tried multiple avenues of treatment. We have to understand with bladder pain syndrome, tackling the symptoms straight away and pain management goes first. If we do not cut off the pain cycle, these patients are prone to have central hypersensitization of the pain, which then becomes a difficult task to tackle. So with this pentosan intravesical installation, it has become an extra tool in the armamentarium to cause this amount of symptomatic relief and cut off the pain cycle and prevent the central hypersensitization. I would like to extend my thanks to Swati Spentos and the entire GIBS core committee and Dr. Taneja and Dr. Pandey and FEPA core founder Dr. Jain and Dr. Vidya, who have been such a force in making a huge difference for the patients suffering across the globe with such problems, which are a chronic debilitating issue. And we have seen such improvement in the quality of life, and these women have regained their confidence. Thank you all and hope to do more for the betterment of these patients.
Thank you, ma'am. Now I would request Dr. Taneja to please answer those questions. Hello. Sir, can you hear me?
Yes, we can. Yeah, Dr. Taneja.
I can answer from here.
Yes, sir.
Is it okay?
Yeah. So we have few questions which we have received from the patients. First is from Rosanna Peterson. She is from South Africa and she is a chef. Her question is, how does one consume enough liquid to not feel dehydrated, as currently increasing liquid consumption ends up with way too many painful trips to bathroom with little or no success?
Yeah, so this is a tricky question because the bladder capacity is reduced. So normally we can hold 500 ml of urine in our bladder, but patients with interstitial cystitis can hold maybe 100 ml, 50 ml or 150 ml. So the trick is to use alkaline water. So you have sparkling water in Europe. We have club soda, which is freely available in small bottles. That is what you can use. Or you can use the baking soda. So if you take alkaline water, it soothes the bladder. The tender coconut water is one of them. It's again a very soothing liquid. So you can take soothing liquids. You can then remain hydrated, as well as the functional bladder capacity would not trouble you, will actually increase if the pH of urine is around 8. So target alkaline diet, alkaline water, then you can stay hydrated and your pain reduces and your frequency is not as bothersome. I hope.
Thank you, sir. We have second question by Dr. Nisha Gupta. She is from India. She asked, root cause of interstitial cystitis.
So had we known, we would have got a diagnostic test by now. So So we see interstitial cystitis is a heterogeneous entity. So there are so many things which contribute to the final assault on the bladder, whether it is an allergic phenomena, or whether it is a vasculitis, whether it is a pelvic floor dysfunction. So all these are neuropathic pains. So these are the four things which emerge finally into the trigone as an inflammatory process. And that is what is the seat of pain in bladder pain syndrome. So imagine there is a bladder which is pushing, and there is the door in the urethra which is not opening. So the bladder keeps pushing, the door doesn't open, the sphincter or the pelvic floor does not open. Then there is a turbulence at the trigone. Once you have turbulence in the trigone, it gets eroded. And as you just heard Dr. Meera from Chennai talking about it, that it is like a non-stick layer which is taken away from the pan. So it becomes rough, it becomes sensitive. So an ordinary person would have a lemon water and he would relish and nothing would happen because there is an insulation at the bladder. But these patients will have tremendous pain, urgency, and need to go to the washroom just because the area which is supposed to convey the sensation of urine has been eroded, and it now transfers the sensation of pain instead of sensation of urine. So this is the difference. So this is how the root cause can be. The final pathway is erosion of the bladder gag layer. We call it technically gag layer, but it is the final insulation of the bladder which protects the interior of the bladder from the corrosive nature of the acidic urine. That gets damaged, and that is what causes the pain.
Thank you, sir. The third question is from Shannon Wolf from USA. She is a patient. She asked, I have had IC since age of 15 and have tried every treatment available. Can you please suggest something which I can get better?
It is extremely difficult to answer this question because somebody would have to go through all the medical records to find out what exactly is going wrong with you. And I can suggest that we can have any of us, we are so many GIBS members now, any of us can, and I'm also available, any of us can communicate. You can forward the email ID, any of us, to her, and then they can send their medical documents. We can study them, and then we can perhaps find an answer for that.
Okay, sir. Thank you. The next question is from Srinivas Reddy Bijam from India. He says that he has pain before urination. What is the treatment for the same?
So this is again pain before urination. Imagine there is a bladder is like a balloon, and there's a wound in the bladder. When the bladder fills up, it stretches, and it stretches the margins of this wound. And as this wound is being stretched, it causes pain. And as soon as he relieves his bladder, his pain would decrease. This is the basic problem with bladder pain syndrome and the interstitial cystitis. And that is why it is important for the bladder to not to be stretched too much, number one, and number two, it should have a proper insulation. So we will like to know what are his cystoscopy findings. Does he really have an ulcer, or maybe a Hunner's lesion or glomerulations, and then plan our treatment. We need to classify bladder pain syndrome into various clinical phenotypes as to what kind of disease is there in the bladder which is manifesting as bladder pain syndrome.
Thank you, sir. Sir, we have a question from Dr. Meera's patient. They ask about any supplement of regenerating the layer and how to avoid the dry mouth.
Oh, regenerating the liver? Layer. Okay. Regeneration of layer. So it is like this. If you have an abrasion on the skin, what we do, we cover it with cotton wool and we allow it to heal. So in bladder, the problem is that the bladder has to store urine. Urine is highly acidic. So every time the bladder mucosa or the bladder layer is exposed to the acidic corrosive urine, the wound increases. So what we need to do is on a skin, you may put a band-aid, just put a sticker, and after 5 days, if you remove the sticker, it would have healed. But you need to put a sticker in the bladder layer. So how do we put it? It is pendozan polysulfate or the camphora that we have. Now we also have the camphora instilled, which is to be put in the bladder directly. So when you put this medicine directly into the bladder, it just covers that area and stays there for some time. And during that period, if we do it repeatedly, because it is going to be washed off, so you put it every week inside the bladder, and then it just keeps it insulated temporarily while the bladder regenerates. Unless you do something like this, the bladder layer cannot regenerate because it is corroded, it is abraded every time the bladder is being filled with corrosive urine. So it is important that we use something, we call it gag replenishment therapy. So something like this, in India, we have oral pendozan polysulfate or camphora tablets, but you have to take that 3 times a day, not less, and 1 hour before meal. The biggest problem is people forget it, then they have their meal and then they take it, it is useless. The second is that you must keep it in cold area, stored between 2 and 8 degrees centigrade. You cannot freeze it, but keep it in 2 to 8 degrees centigrade, which means that it is not affected by the sunlight. So that is there. If you think of intravesical, inside the bladder, how can you put the liquid inside the bladder? Then we have heparin, steroids, we have camphora instill. In Europe, we have other products, and which we do not have in India as yet, but they are just coming in. But we have our indigenous production of pendozan polysulfate, which works very well. You've seen 2 patients from Baroda. They are also using intravesical or the camphora instill they have used. We have 1 patient who improved. But then the problem is you need to keep putting this medicine again and again till it finally heals well. So that is for regeneration. What was the other point, Cheshta?
How to avoid the dry mouth.
So if you are taking an anticholinergic drug, it can cause dry mouth. So if you are taking that drug, you have to report to your doctor, and the doctor has to make changes in the medication. Normally, it is said that in India, we have, if you notice in anywhere where there are bhajans and kirtans, they will keep supari and ilaichi. So not supari, the mishri and ilaichi. It is mishri and ilaichi. So they keep that in their mouth, and that is how you can keep having salivation and you can get over the dry mouth. But if it is really getting dry, you need to change the medicine, and your doctor is supposed to look after that part.
Thank you, sir. We have a question from Dr. Samudra Dharmasiri. He is from United Kingdom. He asked, does every patient with suspected bladder pain syndrome need full assessment with MRI scan, etc.?
So the MRI for bladder pain syndrome, interstitial cystitis, is actually used for research purposes, and it is called a functional MRI. It is not the routine MRI, it is a functional MRI where there are things which are attached specifically to the solution, and then you can visualize which area of the bladder has been eroded and its lining is deficient. But for routine purposes, it is not useful, and it is only for research. So you identify these patients where there is a defect on the MRI, and then they give the treatment and they see it again on MRI and they say, okay, now it is healed. But for routine assessment, no investigation like MRI or ultrasound is going to help. The only thing that is going to help is cystoscopy, and that must be done in all cases.
Thank you, sir. We have one question from Ms. Archana Shinde from India. She is a housewife. She asked, how to be cured from this disease?
So it is a difficult question because there are diseases which can be cured and there are diseases which can be treated. The difference between treatment and cure is in patients who have, like, cure is for malaria. So there is a mosquito which bites, there's a parasite in the blood, you treat, you give chloroquine, and the parasite dies and you are cured of malaria. So that is called cure. There are diseases in which there is no causative factor. Or if the causative factor is your own immunity, like in this disease, if you have autoimmune kind of a disease, then perhaps you cannot change your immunity. So you need to be on medication lifelong. So we cannot technically call it cure. So the idea is to identify what is the causative thing in your particular disease, in your body. Then you identify, like in Apollo, Indraprastha Apollo, Delhi, we have our doctor sitting here who has researched how to differentiate between various types of interstitial cystitis, or how many types. So we have identified 4 types, and we have identified that if we treat one particular, if the person has this particular type of interstitial cystitis, then this disease, this is the treatment. So in a given case, we cannot generalize treatment. So where we started was, before we started, we did not know whether interstitial cystitis actually exists or not. And today we are talking about, we have identified interstitial cystitis, we have dissected it into 4 parts, and then we are treating each part specifically, and that is how our patients are getting treated. So it is important that we identify the cause and then treat it. So maybe in coming years, you will hear the research papers coming from our hospital for that.
Thank you, sir. We have next question from Mr. Arup Kumar from India. He is a professor of urology. He has long-term outcome and quality of life of these patients.
Yes. So it is again depending upon what is the etiopathogenesis in a given patient. For example, those patients who have Hunner's lesions, you do cystoscopy, you do hydrodistension, you give them pendazole polysulfate, they improve rapidly. We give intravesical steroid therapy every week for 6 weeks, they improve very well, but then they come back after 6 to 8 months for a next session of hydrodistension and cystoscopy. So these are the patients in whom we are now trying to use tacrolimus, which is again one of our research projects, that we want to try something which dips the immunity so that these patients, they do not come back with Hunner's lesions. Those patients who have pelvic floor disorder, as I said, dysfunctional voiding, the bladder is pushing and the sphincter is not opening. In those patients, we give muscle relaxants, we give physiotherapy to the pelvic floor. So physiotherapy for pelvic floor to relax the pelvic floor so that they can pass urine, and that is what helps. So individual patients have to be treated individually. Those patients who have pelvic floor disorder, they do very well long term on skeletal muscle relaxants and pelvic floor physiotherapy. Then there is a group of patients who have neuropathic pain. So they have a nerve which is tingling there, and that just sends a signal. So these patients we identify because they have a pinprick sensation in that area when the bladder fills. So if the patient has come to you with a pinprick sensation, you give amitriptyline or tryptamine, and it works wonders. Those patients, the relapse is very rare. Once they are treated with tryptamine, they do very well. So this is how we have now started dissecting this disease process into 4 subsections. And we have identified that there are patients with certain subsections where they do very well. But in others, like Hunner's lesion, it is still a challenge. And we have certain patients here who have Hunner's lesions. We are still struggling, and we know how to treat, but the long term, we still do not know. All I can say is that we all sitting here are part of evolution of history this will be history, because 25 years from now, people will read about it, and because there was nobody 25 years before us. So we are evolving the science of interstitial cystitis, and you all are part of the history of evolution of this disease process. So maybe 20, 25 years from now, people would know much better than what we know today, because we know better than what people knew 25 years ago. So long-term, etiopathogenesis-based treatment is the only answer, and some will respond very well, others will not.
Thank you, sir. We have next question from Dr. Kang from London. He asks, how do patients avoid worsening of bladder pain that might be triggered by spicy food? Does yogurt or other food help to lessen such flare-up?
Yes, we have already heard so much. Dr. Meera has talked, Dr. Amita Jain has talked, our dietitian has talked, and that is why we are here today, because we need to identify foods which cause flares. And the book that we recently released today for Indian population in Hindi would be handy for that, but we already have it as an English version. So I'm sure we need to educate the families. It is not only the individual, because the individual may forget. So if you teach the patient's daughter or son, they would keep a vigil that, look, you don't have to eat this, the doctor has it. So you give them a written list. So we have a written manual, which is called a book here in this case, where we should reach every household who has a patient like this. And yes, yogurt, as I said, if you look, because this question comes from a doctor, I will talk technical here. The curd comes from lactose being converted into lactic acid because it is fermented. So the pH of curd is acidic. I have been talking about alkaline foods. So obviously, if you are taking an acidic pH, that has to be excreted through the urine, and that has to cause some kind of injury or pain or flare in the bladder. So we need to learn from these experiences.
Thank you, sir. The next question is from Mr. Umesh Bora. He is a patient from India. My problem is food related. My doctor listed a number of items like chili, ginger, etc. that should be avoided. I am at present living a normal life without much problem. My question is, will I be able to consume spicy food someday?
Yes, Mr. Bora, thank you very much for asking this question. So he's our patient from this hospital. He's doing very well. And he comes from a community where you cannot live without spices. And it is actually, I apologize to him because I cannot allow him to go for spices and enjoy that part of his life. But let us hope that your bladder heals, and we'll slowly introduce or reintroduce some of the spices, but in a graduated manner. We cannot introduce all of them together, but we will use slowly. You can come for a discussion. I hope you could come here today so that we could have discussed your point and we could have developed a strategy how to reintroduce diet in your case.
Thank you, sir. Other question is from Dr. Manisha Acharya from India. Her question is, as vitamin C is not tolerable for IC patient, how to overcome the vitamin C deficiency?
So vitamin C is ascorbic acid, and ascorbic acid has to be taken in an acidic medium. So if you take it in an alkaline medium, it will be killed. Unfortunately, we will have to do something like this. So you take a vitamin C, and after 2 hours, you alkaline the system. Once it is absorbed from the gut, it goes into the blood. Then you have to alkaline so that the final pH in the urine is going to be alkaline and not acidic. So you can take vitamin C supplement, and after 2 hours, you take, for example, a baking soda, a pinch of baking soda and a glass of water from the kitchen. I think that should do the job.
Thank you, sir. Next question is from Ms. Asha Chadwani. She is a patient from India. Her question is IC curable or a lifelong problem?
So I hope Ashaji, again, she's my patient from here. So I hope you have heard this discussion. It is difficult. As of today, we have to accept that our community medical fraternity has not been able to conquer it completely. The only thing I can say is that we can help you as much as possible, but to say that it will go away is something that we cannot answer that as of now. And we are still evolving, as I said. Maybe 20 years from now, 25 years from now, we would find an answer to your question. But then this is how it is.
Thank you, sir. The next question is from a patient advocate from Netherlands by Jain. Her question is, lack of proper sleep can have a huge impact on IC-BPS patient. How can this be tackled?
Pardon, I couldn't understand this. Lack of
Lack.
sleep. Okay, Jain, I'm glad that you are there. So Jain is a dear friend. She runs a Interstitial Cystitis Bladder Foundation, and she herself is suffering. But thank you for asking that question. Yes, stress is supposed to cause flares, and stress is also supposed to reduce the immunity. So when you are not sleeping well, your body is stressed. Whether you identify this or not, the body is actually revolting. But we as evolved animals, because we keep thinking, we have been bestowed with the strength of thinking, so that since we can think, we can overcome the sleep, or we can prohibit the sleep from coming. But our body, the physical body, actually requires sleep. So there is a kind of war between the physical body and the mental state, and that is not good in any form. So it generates redox ions, the negative ions, and they can cause acidity in the urine, because they have to be excreted. Any excess production of acid has to be excreted through the urine. So when it is excreted through the urine, it is likely to cause a flare in the bladder. I hope you're doing well, Jain. You're listening this.
Thank you, sir. The next question is from Mr. Rupesh Parekh from India. His question is how to identify which food is causing flare-ups. Is there a permanent treatment for Hunner's lesion?
Yes, Mr. Parekh, if you're listening, I told you we are starting to have a trial of drug. Maybe I would ask you to come to the hospital for that once we get the ethics committee approval for that. So that is for the Hunner's lesion. As far as diet is concerned, there is a very simple formula. We tell you to go on a bland diet for 1 month, which means you have just porridge or kheer or something which is very bland, with little salt, little sugar, no spices. At the most, we allow them the skin of the green chili, not the seeds, because they are concentrated acids. The skin of the green chili, cilantro, that is dhania. So all these things can give you flavor in the food. The alkaloid spices, which are the jeera, methi, and dhania. These are the things, the coriander and cumin. These are the things which you can try during this 1 month period. Once you are on a bland diet, which is absolutely wash out for the bladder, then you slowly introduce the acidic spices and then find out which food item is troubling you. For example, then the next step is you can start with the simple lemon water. You can start with curd. Then you can keep identifying, okay, these are, because there is a huge difference between patient to patient when it comes to diet. When we were surveying our patients for diet, there were a few patients who would talk about mangoes being absolutely no-no. And then there were few patients who would say, this variety of mango hurts, while the other one said, no, this variety is good to me, but the other variety hurts. So that is how we had the discussion. So it was a great learning. That meeting was a great learning for us, because we know that there is so much of variation in diet that some diets are going to hurt the bladder most in some patients, whereas they may not hurt the next person. So it is best that you find your own diet chart. You have your own logbook. So you have bland diet for a month and then slowly introduce some substances and see which one is triggering. And then you can come back and tell us, educate us. I'm here. Educate us that, okay, this is the thing which did not help me or it did bad to me. It did cause a flare, so that I also can help and tell it to the next patient that this is how it works. That is the whole idea of the patient group that we have. And that is the whole idea of this kind of meeting. Thank you for asking that question, Rupesh.
Thank you, sir. We have next question from Mr. Brijesh Chandra from Nepal. He is an IC patient. His question is, foods to be avoided by IC patients.
I've just answered. I think Rajesh, you would have listened to this, and I'm sure you're going to get better after this.
Thank you, sir. If any centers have any questions, then please go ahead.
So if there are no more questions, Cheshta, it's
Yes,
already past 5 and we should close the ceremony. So
Sorry, sir. I would just like to mention we have Dr. Sandor Loas with us.
Oh, Sander is there from Budapest. Hi, Sander. Nice to see you here.
Oh, hello. It's nice to hear you. I enjoyed your very clear explanations on different questions. It's very useful. We also make such web discussions with patients. I can say we get very informative feedback from the patients, which lead us to improve our method. So this discussion with patients is very useful. Thank you for that.
Thank you, Sander, for getting time out from Budapest to join us here. He is our core committee member of GIBS from Hungary.
Thank you.
So we have Dr. Sood as well as with us on board.
Yes.
Yes, Dr. Taneja, it was wonderful listening to you as usual, and you have very well tackled all the important aspects in the question answer already. We are only thing is that future is bright for all the people. You know that we are coming with intravesical devices also, intravesical installations also. And those who are worrying that whether it is lifelong or it is only temporary and it will be cured. So it is something in between, and mostly it remains controlled. So that is my comment, and rest is with Dr. Rajesh Taneja.
So let me introduce Dr. Rajesh Sood. He's a dear friend. He is an ex-dean of RML Hospital, and he's been a president of Urology Society of India. So thank you, Dr. Sood, for joining in and giving your expert comments. Thank you so much.
Okay, thank you.
So Cheshta.
Yes, sir. If you allow, we have 2 minutes audio of 2 patients.
Okay, you can carry on because it is a patient's day, so we cannot use that.
Yeah, thank you so much, sir.
हाय, मैं 76 साल की मेरी उम्र है और मुझे पेनफुल ब्लैडर सिंड्रोम कई सालों से चल रहा है। करीब 6-7 साल 8 साल तो हो गए होंगे। शुरू में समझ में नहीं आता था मुझे ये तकलीफ़ क्या है। बार बार यूरिन पास करना, बार बार जलन होना, कई बार मुझे स्पैज़्म भी होते थे। फिर मैं डॉक्टर के पास जाती रहती थी, मुझे एंटीबायोटिक भी दी गई कई बार। 2-3 साल तक 4 साल तक ऐसे ही चलता रहा। फिर मुझे पेनफुल ब्लैडर सिंड्रोम डायग्नोस किया। उसमें फिर मुझे तकलीफ़ हर 2 महीने में 3 महीने में हो जाती थी। फिर भी मैंने हिम्मत नहीं हारी, मैं डॉक्टर के पास जाती रही और दिखाती रही। कभी मुझे एंटीबायोटिक दे देते थे, कभी मुझे ज़्यादा पानी पीने की एडवाइस मिल जाती थी। फिर धीरे धीरे करके तकलीफ़ जब बढ़ती रही, तब फिर मुझे डॉक्टर ने 2021 में 6 इंस्टॉलेशन दिए ब्लैडर में। उसके बाद से मुझे फ़ायदा हो रहा है, बहुत फ़ायदा हो रहा है। मुझे अब 2021 के बाद से अब बहुत कम जाना पड़ता है, और जब भी तकलीफ़ होती है तो मुझे ट्रिप्टोमर मैं ले लेती हूँ। शुरू में डोज ज़्यादा लेती हूँ, फिर धीरे धीरे करके उसको टोपर ऑफ करती रहती हूँ। इस तरह से मैं अपना नॉर्मल लाइफ अब जी रही हूँ। मुझे अभी 4-5 महीने से कोई तकलीफ़ नहीं हो रही है, और मैं 10 mg की ट्रिप्टोमर कभी कभी ले लेती हूँ। इसमें बस मेन मुझे ये देखना पड़ता है कि मुझे कोई भी सिट्रिक फूड नहीं खाती, ज़्यादा बहुत परहेज़ करना पड़ता है मुझको। मैं कभी भी कोई कॉफ़ी टी ये भी ज़्यादा नहीं लेती। मैंने ये नोटिस किया है कि ये भी लेने से मुझे बढ़ जाता है। विंटर में भी मैंने ज़्यादा टी नहीं ली, और खट्टा तो ऑलमोस्ट काफ़ी कम कर दिया है। खट्टा फल कोई भी नहीं खाती मैं। जब तकलीफ़ होती है तो अल्कासोल पी लेती हूँ दिन में 3-4 बार, और ट्रिप्टोमर ले लेती हूँ 10 mg की, एक मेंटेनेंस डोज की तरह से। उससे मुझे फ़ायदा हो रहा है, मुझे तकलीफ़ कम हो गई है। अब 3-4 महीने से मुझे स्टेबल है, इसलिए इसमें हिम्मत नहीं हारनी चाहिए। ये तकलीफ़ ऐसी है कि आप अपने आप भी फाइट करिए, तो ऐसा नहीं है कि नहीं ठीक होगी। और दवाई डालने के बाद से मुझे बहुत फ़ायदा हुआ। उसके बाद से मुझे तकलीफ़ धीरे धीरे करके कम होती जा रही है, उतनी नहीं होती थी जितनी पहले होती थी। बस यही मेरा कहना है आप लोगों से कि जिसको भी ये तकलीफ़ है वो हिम्मत रखे। ऐसा नहीं कि ये तकलीफ़ दूर नहीं होती है, ठीक हो जाती है।
हेलो, मेरा नाम सरिता है। मैं कुछ ऐसी बातों के बारे में शेयर करना चाहूँगी जिससे बहुत सी लेडीज़ फेस करती है, बट कुछ बोल नहीं पाती और कुछ बोल देती है। इस परेशानी का नाम UTI, यूरिनरी ट्रैक इन्फेक्शन है। इस इन्फेक्शन से मैं भी 20 साल तक गुजरी हूँ। मैंने कोई जगह पर काफ़ी ट्रीटमेंट कराए, बट उसका कोई सॉल्यूशन नहीं निकला। मैं सिर्फ 25 साल की थी जब मुझे यह प्रॉब्लम स्टार्ट हुई। इनिशियली ये कम थी, फिर टाइम बढ़ता गया और प्रॉब्लम भी बढ़ती गई। मुझे वेजाइना और फीट में काफ़ी बर्निंग सेंसेशन होती थी, जो इवेंचुअली आइज़ में भी फील होने लगी। मुझे ये इस कगार तक बढ़ गई थी कि मैं 4-5 घंटे तक वॉशरूम में के बाहर निकल नहीं सकती थी। मुझे कंटिन्यूसली बर्निंग वेजाइनल डिस्चार्ज होता था। शुरुआत में होम रेमेडीज़ यूज़ करती थी, जैसे कि कोकोनट वाटर, कर्ड एक्सेट्रा। फिर मैंने काफ़ी एंटीबायोटिक्स ट्रीटमेंट भी लिए, जिसके काफ़ी साइड इफ़ेक्ट तक झेले। बट मेरे उससे पेनफुल जर्नी में मेरे हस्बैंड ने, मेरे बच्चों ने मेरा बहुत साथ दिया और सपोर्ट भी किया, और मुझे मोटिवेट भी किया। तो इस बीमारी से बाहर निकालने के लिए उन्होंने मेरा काफ़ी साथ दिया। The food that aggravated my problem the most was garlic, ginger, chili, and later on I got to know about the aggravation due to citric food like orange and apple. As well, I was fortunate enough to educate myself regarding the insulation treatment, which initially was taken ahead by the prestigious doctor, but for which we had to get hospitalized for a day and also involved antibiotics along with a high risk of infection in the hospital premises. And later on, me and my husband were encouraged by the honorable doctor to take a session on self-insulation treatment that could be done by ourselves in our own house with zero antibiotics and with very low risk of infection, which was definitely even more convenient as it didn't involve hospitalization. I thank doctors and hospitality involved, which helped me recover the worst health issue I had to undergo. Today, by God's grace, I am absolutely fit and fine with no requirement of any meditation and insulation. मैं आप सभी से ये रिक्वेस्ट करूँगी कि प्लीज़ help yourself and your family to recover from such illness by just a very simple and safe process of self-insulation to lead a happy, healthy and UTI-free life. I would like to express my sincere gratitude to the doctor who encouraged us and changed our lives completely.
Thank you very much. So it is my humble duty to thank everyone here, starting from Mr. Shiv Kumar, our Managing Director, who found time on a Sunday to be with us. Mr. Mr. Rajeshwar Dayal Vashisht, who has done a tremendous job of finishing the book, converting it to, and I notice now Dr. Vipin Gupta, please come to the dais, we're waiting for you. Dr. Vipin Gupta is a medical doctor who is now running a publishing company, and it is because of his efforts that in a very short time, we could get the book out. So I must thank Dr. Vipin Gupta. I must thank Dr. Ranjana, Dr. Nilanjana, who have always been with me whenever I ask for. I thank Mr. Atuldev, who has been very kind to us to be here. I thank Deepti and Cheshta, Meera, Dr. Rajiv Sood, Dr. Amita Jain, and so many other patients and doctors who have been, I don't even know because they are connected on internet. I can't see the names, but thank you very much for, you must know Deepti and Cheshta. These two ladies are the administrative hub of the Global Interstitial Society's Bladder Pain Society. They're based in Mumbai, but they work so hard to get any kind of program that we have. And believe me, we have one webinar a month. We have one webinar a month where we are focusing on one state or one city. And all these people, every time these people would organize a webinar for 2 hours, that's almost once a month. And then we have an annual conference, and these people work very hard. I must thank Mr. Vishal Jajodia, who has been a financial support to this movement. He is the owner of Swati Spentos Limited, but he has never ever appeared like this. But then he is a philanthropist in true sense. He would just tell me, whatever you want for this disease, please let me know. And I have never been, disappointed from his side. I must thank all the patients who are here, like here physically or online, who have been able to come, meet, and share their experiences. We are really grateful, and teaching me the disease, because as I said, we are evolving. In the last 25 years that I've been looking at these patients, I have really evolved my understanding, and I will continue to learn from you, because I have to get back to you for your queries and your pain to be reduced. And of course, my secretary Prerna, who has worked tirelessly for every program. You know how she works in the OPD. Those who have come, who have seen her work in the OPD, and she is a wonderful girl, and I wish her all the best, and I bless her with all the happiness, because she's the one who does the things on this track. Thank you very much. And now, Cheshta, we will have our local program. Our MD is going to give away the copies of the book, and anybody who needs the book, you can just get in touch with Prerna. She would organize to deliver the books wherever it is required. It is in Hindi. Thank you very much.
Sir.
We can close if there is nothing else, we can close the online session.
Sure, sir. Sure. Thank you all for joining us with us today. Thank you all. Thank you.
Thank you so much.
Prerna,
Thank you, Dr. Meera. Thank you, Dr. Amita.
We will give away.
Thank you all.
Thank you, Dr. Nawaz, for joining us.
So you can have the list.